So let's start a new subject, that is anesthesia. So we will try to cover it in minimum time possible. This is rapid revision course. So we have covered the entire subject in 19 pages only. Okay. So let's start anesthesia. So what are the induction agents? So why we need induction agents? So if you are surgeon, if you are orthopedic surgeon or general surgeon, and you have to perform so many surgeries, so you can't perform surgery in awake patient, you need anesthesia. Okay. So in anesthesia, they use various induction agent. So what is the induction agent? What are induction agent? There are various intravenous agent, there are various inhalational agent. Okay. So what is the role of these induction agent? They put patient to sleep. Okay, they put patient to sleep. There is analgesia. Okay, so analgesia, they give muscle relaxant, so they put patient to sleep. Airway management, so induction agent is causing the respiratory depression, so we can give oxygen, because all the induction agent, most of the induction agent causing the respiratory depression. Why? Because you can understand that anesthetic agent slow down the metabolism of body, so they mostly they cause the respiratory depression. So because they are causing the respiratory depression, you have to give oxygen, and anesthetist also give the muscle relaxant to the patient. Why? Because muscle relaxation helps surgeon to dissection of muscle. Okay, and also if they want to give oxygen, so they have to intubate patient. They have to, if they want to give the general anesthesia, so they have to put the endotracheal tube, so that they can give the gas, they can give the sevoflurane, they can give the anesthetics. So muscle relaxant is used, so there is no gag reflex by giving the muscle relaxant. Are you getting my point? So induction agents, so basically we have understood induction agents are causes the respiratory depression, and they suppress the gag reflex, so they causes the respiratory depression. So we have to give oxygen, because respiratory depression patient will go in apnea, so we have to give oxygen. Okay, and muscle relaxation, why we give? To relax the muscles. So surgeon, it will help surgeon for the dissection of muscle. Okay, it also help the anesthetist, because it suppress the gag reflex, so you can easily put the endotracheal tube. Okay, now pre-anesthetic checkup. So what is pre-anesthetic checkup? So because a person came to the surgeon, and surgeon has planned for femur interlock nailing, the patient has femur fracture and surgeon has planned femur interlock nailing. Now the patient age is 40 years, so you can't take patient directly to the OT. You have to do some investigation, that is the patient has enough hemoglobin, is the patient is hemodynamically stable, is the patient is on any medications. Okay, so now a patient is of 50 year of age, having femur fracture, and he is taking anti hypertensive drug. So what is the protocol? Of patient who is taking the anti hypertensive drug? What is the protocol of giving anesthesia? And what is the protocol for the drugs? These drugs, the antihypertensive drug should be stopped or not? So let's talk about the pre-anesthetic checkup. If patient is on antihypertensive drug, so you have to continue the antihypertensive drug except the ACE inhibitor and ARBs. Why? Because ACE inhibitor blocks the renin-angiotensin mechanism, and anesthesia, when you give spinal anesthesia, it causes the vasodilation, it causes the hypotension suddenly. So you need renin-angiotensin mechanism to recover, and ACE inhibitor is blocking that mechanism. So you can continue the antihypertensive drug but accept the ACE inhibitor. Okay, next is patient who is having diabetes mellitus and undergoing surgery and plan to undergo surgery. So in that case, all oral hypoglycemic drugs should be stopped on the day of surgery except SGLT2 inhibitor, because SGLT2 inhibitor causes the euglycemic ketoacidosis. So this will hamper the anesthetic agent, metabolism of anesthetic agent. Okay, next is hyperthyroidism. So in hyperthyroidism, you have to give antithyroid drug till the day of surgery. Now there are so many psychiatric diseases. So in psychiatric diseases, you give antidepressant, you give Antipsychotic drugs, so you have to continue these drugs till the day of surgery, except MAO inhibitor. Why MAO inhibitor you have to inhibit? Because it interfere with the pethidine, and pethidine is we normally not use, but it is used in liver analgesia, liver anesthesia. Okay, so we have to stop MAO inhibitor. Now a patient is a known case of MI, so patient is a known case of MI, so you have to stop blood thinners 5 to 7 days before the surgery, and you have to give the low molecular weight heparin. Okay, clopidogrel stop 7 days before, ticlopidine 10 days before. Okay, uh, anti-tubercular drugs, so you have to continue the drug till the day of surgery because it causes the multi-drug resistance in patient. Okay, herbal medication you have to stop 2 weeks before because it affect the liver function, and anesthetic agent interfere with the liver metabolism, so liver should be normal at the time of surgery. NSAID you have to stop 2 days before because NSAID affect the renal function. Diuretics, all thiazide diuretics should be stopped 20 hours before. Okay, alcohol 2 days before because alcohol is also depressant as well as anesthetic agents are depressant. Smoking, it should be stopped 6 to 8 weeks before surgery because it increases the bronchospasm risk. Are you getting my point? Because you need larynx should be open, it should be free because you have to insert the endotracheal tube during the time of anesthesia in any case. So in anesthetic agent, in smokers, the lung airway is irritable, so it causes the bronchospasm. Okay, so patient can go in apnea, so you have to understand. Now, so are you getting a point? Why? So for pre anesthetic, you can't take anyone in OT without doing the proper investigation, without doing his past history. And when you are planning for 50-year patient for femur interlock nailing femur surgery, you have to take his past history of drugs, whether he is taking the antihypertensive drug or not, if he is taking the which type of drug is taking, ACE inhibitor or ARBs. Okay, because these interfere with the anesthetic agents. So you have to understand that you have to stop the blood thinner 5 to 7 days before. Why? Because blood thinners, surgeon is doing operation, so it leads to excessive bleeding. Okay, so you have to stop these drugs. Now herbal medicines 2 weeks before surgery you have to stop because it affects the liver function. NSAID, it aggravates the renal injury. Okay, so we have understood all these drugs. Next topic is anaphylactic shock. So anaphylactic shock we have learned in pathology also. So it is due to, most common factor is antibiotics. It is due to antigen antibody reaction which causes the histamine release. Patient will have sudden tachycardia. How will you manage this patient? By giving 1 milligram in 1 into 1000 dilution. IV route is preferred. Injection adrenaline is given. Okay, so this is the management for anaphylactic shock. Now ASA grading. So ASA grading is done for the physical status of patient. Grade 1 is normal patient. Grade 2, patient having disease but it is controlled. So controlled hypertension. Moderate to systemic disease, it is CKD, chronic kidney disease. Severe systemic disease, unstable angina. Morbid patient who has life expectancy less than 24 hours. Brain dead patient. Okay, so this is the sixth grading ASA grading to know the outcome of patient. Now pre-op preparation, so you have to do the basic investigations like CBC to know the HV should be greater than 10 gram, platelet should be 1.5 to 4 lakh, RFT to know about the ongoing kidney damage, LFT, because all these all interfere with the anesthetic agents. Okay, UPT is mandatory in all pregnant females. Okay, and you have to understand these all are investigation valid for 2 months only, valid for 2 months. Okay, now the pre-medication. So what is pre-medication? So because if you say to someone that you are posted for OT for tomorrow, and if you say to someone that you are posted for OT for tomorrow, then patient will be in anxiety. So to relieve that anxiety, you have to give benzodiazepine. And why are you giving the anticholinergic? To reduce the secretions. Why fasting? 6 to 8 hours for solid food, 2 hours for clear food. Why? So if you, we used to go in ortho ward, and if any patient is posted for next day OT, so we used to keep him fasting till night 12 a.m. So we used to say to patient that रात को 12 बजे के बाद आपको कुछ खाना पीना नहीं है, because fasting is important. Fasting is important in anesthesia. You need 6 to 8 hours of fasting for solid food. So if you are taking patient OT on at 9 a.m., so you have to do fasting for at least 6 to 8 hours. So you have to do fasting from night. Okay. Because if there is food content present in the stomach, then it could lead to aspiration pneumonia, because it suppresses the all reflex. Anesthetic agent, general anesthesia, or suppresses the all reflexes, so it could lead to aspiration pneumonia. Okay, now emergency surgery. So now let's assume a patient came into casualty with acute appendicitis. A patient came to the casualty with acute appendicitis, and he is having severe pain, and you have done USG, and you find that he need emergency surgery for appendectomy. Now you can't wait for 6 to 8 hours of fasting. So in that case, you have to go for emergency surgery. So in emergency, you have to pass the nasogastric tube and aspirate all the gastric content. And or other way, you can inject the metoclopramide to increase the gastric motility. You can inject the PPI to stop the acid secretion. Okay.